saw her coming out of a Payless or something.
Yeah.
Oh, wow.
Okay, 6:51. Let's get Dr. Peter Lombard on. I don't have a lot of time this morning, but Doc, you're crunching COVID numbers, and you finally got some numbers, unfortunately, to crunch.
Yeah.
Last week. So I guess just real quick, what's your take on this latest spike and surge with COVID-19 positives on island?
I'm trying to kind of wrap my head around how we can go from 14 positives in one day of about 300 tests to over the next 3 days we did 850 tests and only 3 positives, and that discrepancy is just kind of hard to rectify, especially when you know that we're testing the contacts of the positive tests that we were getting. So I think that certainly some of these positives we're getting are actually what's termed as a repositive. And if you look at Korea, they're doing a really great job of looking at these repositive tests. So just like I think one of our first cases in Guam, if you remember, he just kept testing positive over and over and over again. And so this phenomenon of testing positive and seeing maybe old dead virus that's not actually infective is not a new one. But last week, Korea, they looked at about 200 of these people, and they contact traced about 800 of people that were in contact with them, and none of them were infected by these people that were what's being termed as a re-positive. They also estimated that 50% of people who test positive for the first time will test re-positive again sometime within the next 2 months if you were to test them again by PCR. So that's a pretty astounding number. And so you have to wonder if some of the new positives that we're testing were infected previously, but never had symptoms enough that warranted them getting tested at the time. And now they're now one of these re-positives. So that might be an explanation. It still doesn't, other than just a statistical anomaly on that day of 14 cases in the community where none of them are really related to each other. It still doesn't necessarily explain that. I just have to chalk it up to statistics. You're going to get some days which just don't make a lot of sense compared to the other ones because, as from what the governor said and from what we're hearing, there's really no relationship between these 14 cases to one another or to any cluster.
And that's why they were saying they were very concerned about them.
Right, and so that's why these last 3 days are, huge sigh of relief for me. And looking at the hospitalizations we had one at the end of last week, and I think now we're down to none. So that is just fantastic news. And that's, if you look at the last 2 weeks, we've had almost 60 positives. 60 positives, that's pretty much as many as we had the previous 2 months. And so if our new normal is one hospitalization for 60 positive cases, and when that positive mix may be new and old, then I think that's a useful number for us to think about. Because if we're not going to overwhelm our system with 50 positive cases, we're not going to overwhelm it with 100 positive, maybe even 200 positive. It's only 4 admissions if you kind of think of it like that. So I think there's a difference in the way that the virus hasn't changed. It's still going to affect people the same way. But I think that the way people are being infected is different, and it could really be primarily just due to mask use. The amount of virus that gets inoculated in somebody's airways is much reduced, and maybe that is the reason why we're not seeing as much severe disease. And the demographics is shifting. As you know, we're seeing this all over the U.S. Cases are skyrocketing, but the demographics of the people getting infected are people that are much younger. So we know that they're going to have less severe disease. And I also think probably in the U.S. as well, and they probably don't wear masks quite as well as we do in Guam, but probably the viral inoculum is going to be less. We are starting to see a little bit of an uptick in deaths where, we weren't seeing it. We were seeing this big divergence in the U.S. of cases skyrocketing, but deaths continuing to go down. But the past 2 or 3 days, we have actually seen the deaths start to flatten out and rise a little bit, and that is concerning for the U.S. for sure.
Right.
And in Guam, hopefully we don't see that. But, deaths have to follow hospitalizations, and we're just not seeing the hospitalizations, and so that's very good news for us.
Doc, and saying what you said about having these 14 positives out in the community, and then we did a bunch of mass testing and not yielding the kind of numbers that maybe people thought. Do you think the government reaction to these positives is warranted? delaying the opening of tourism,
Yeah.
rolling back some of the quarantine measures?
It's conservative, and that's probably smart. I think at least until these 14 cases get a week out, and you can see if they're going to turn into hospitalizations or not. I think that's smart. Now, what we might be able to do in case this happens in the future is say, well, what is the demographics of that group? If they're all under 50, then we're not going to worry about it. If they're all over 50, then that would be something more concerning that might want to trigger some sort of change. So I think we're dealing with different types of infection of people being infected with COVID now than we were in April and May, and I think that matters when it comes to what we're willing to tolerate when it comes to the risk to the general population, the risk to our susceptible population in particular. I think we're doing a better job of protecting our elderly, and so I think that matters in terms of how a policy, and that might mean we're willing to accept a little bit more risk to again to start bolstering the economy a little bit better.
I wanted to ask, what are your thoughts on the new quarantine protocol that goes into effect on July 1st after midnight with the 72-hour pre-arrival PCR test, and then the other option of for those who are on home isolation to be able to test out after 7 days?
Yeah, we've been talking about this on our physician chats quite a bit. It's definitely a conservative, safe policy, and if that's what is most important to most people, then I think it'll be accepted by most people. The safest would be to do 3 tests, one before, one on arrival, and then one 5 to 10 days later. The next safest is 2 tests with some sort of quarantine, and then 1 test is obviously less than that, and no test would be obviously the highest risk. But so 2 is kind of in the middle. It's still pretty conservative. You're still going to catch quite a bit of folks that become positive as they're traveling or right before they travel or within the first couple of days of travel. You still are going to pick those up. Now, but again, it comes back to what is the nature of these infections, and how risky are they going to be to the community? If they do result in a couple transmissions, and it's within a patient demographics that we can tolerate, then maybe we can actually live with that. I think we need to. It's a tough sell anytime you're trying to relax restrictions too much. You're going to get detractors on both sides. So the ones that want to open things up more are going to be upset with how restrictive this is. But if you start to pull back, you're going to get people think it's crazy. How can you let more virus into the island? So it's a tough position that the administration's in to try to come up with something. So I think the one they have is conservative, but given the recent positives, I think that's okay until maybe another week or 2 go by. But and they seem to be very willing to change and adopt the strategy according to new information and what we're learning about the virus, which is great.
Mm-hmm. What about what are the physicians in these chat groups saying about because of these increase of spike in the cases of confirmed COVID-19 cases? Are any of them saying that maybe we just opened up a little too early?
Surprisingly, no. We're not really seeing that at all. I think more the sentiment is probably that we need to be a little bit more relaxed about opening things up. I don't know if that's surprising or not, but people are kind of trying to. Nobody knows exactly what's happening out there, but we're trying to read the tea leaves and put the different pieces of facts together. You got to look at some people were making drastically wrong predictions months ago, and some people were a little bit closer to reality, and maybe those are the people that have a little bit better sense of how to put everything together.
Well, we're going to be talking to Dr. Cabrera in about 30 minutes or so. So if you want to listen up to that.
Yeah, thanks. I certainly will.
Okay, Doc. Appreciate your time this morning.
Okay. Thanks.
All right, take care.
Okay, wash your hands.
Bye-bye.
Bye. 701. That's Dr. Peter Lombard. Interesting perspective there, saying, hey, we had 14 cases all over the island, and then the mass testing that we conducted didn't yield the type of positive numbers that at least he thinks would indicate a